designed this training to provide you the information you need to write a fabulous proposal for our call, which is coming out on April 14th, and will include funding to either plan to do an evidence-based intervention, which is at $10,000, or to implement an evidence-based intervention, which is $20,000. And so today our focus is on what is an evidence-based intervention. So these are all the components of the proposal. So last week, Mary covered project overview, what really documenting your problem, the significance of your problem, and writing SMART objectives. So that's done. So today we're going to focus entirely on evidence-based interventions. And then our last session, we'll talk about writing a project plan and an evaluation plan. So I'm going to get started with today, which is finding, selecting, and adapting evidence-based interventions. By the end of this session, I'm hoping you'll be clear on what an evidence-based intervention is, where you can go to find an evidence-based intervention or EBI, how you can think about selecting the best EBI, and we're going to just briefly touch on steps for adapting an EBI to improve fit. So we're going to start with a poll. Mary, do you have a poll to put up? All right. So just when you think about, I want to do something new to improve health in my community, where do you go to look for ideas? Oh, wow. Excellent. All right. Mary, can you share the results of that?
They should be shared.
Oh, there we go. So colleagues are a great source. Your professional organization is a great source. The community guide is one of the places we're really going to talk about today. Cochrane database, we're going to talk about briefly. We're going to briefly talk about what works for health. And then I'm glad to see 2 out of 3 people are using the evidence-based cancer control programs, which is another source we're going to talk about today. Let's see. Oh, it goes down further. And journal articles, we're also going to talk about that. Does anyone want to share the other? You don't have to, but if you're willing to share the other that you were thinking of.
I put other because I get a lot of information when I talk to people in the community, in my church, in my clubs and social groups. Okay. That's where I get a lot of just going directly to the people I'm trying to reach.
Great. That is so important. Okay, stop sharing. All right. So now we're going to talk about what we mean when we say an evidence-based intervention. So starting by what we mean by intervention, and we define that very broadly to include programs, practices, principles, procedures, policies, pills, products, you name it. Anything that you do that is intended to improve health-related outcomes is an intervention. When we talk about evidence-based, so this is what we're talking about. So this is an evidence pyramid. And at the bottom, you see expert opinion or personal experience, which is very important. So absolutely, we want you to find out what the people in your community think will work, what their ideas are, what your colleagues have found worked, which you can also get from newsletters and practitioner reports in other places. Those are all great sources of ideas, but we don't consider those evidence-based. When we talk about evidence-based, we are looking for interventions that have been tested and found to be effective in one or more research study. So today, that is what we mean by evidence-based, but ideally you are doing both. You are talking to the people in your community and your colleagues, and you're looking to the research evidence and putting those together. But today we're going to focus on the research evidence and what we consider evidence-based. And we're going to talk about two kinds of interventions. One is a research tested intervention, which is a specific named intervention that's been tested and found to be effective. The other is recommendations from systematic reviews, which is where someone looked at lots of studies that used a broad type of intervention and report on the evidence for its effectiveness across all those studies. So those are the two kinds we're going to talk about. So we're going to start with those systematic review findings or recommendations, which again are broad recommendations for intervention approaches that are effective. Evidence-based interventions to include increased colorectal cancer screening include things like reminding providers, reminding patients or clients that it's time for them to get a screening, reducing structural barriers for patients or clients, which we were just talking about. If you take a mobile van and drive it into a community, that's reducing transportation barriers. It's also, depending on how the screenings are funded, it's also reducing financial barriers. So those are evidence-based recommendations from systematic reviews. Sources of systematic review findings or recommendations. We're going to talk mostly about the community guide today. We're going to which is over top to the right. We're going to briefly talk about what works for health, which is in the orange there. PubMed, which is where you can go to find journal articles, is a good source as well. So you often have to work with a medical librarian. The same with the Cochrane collaboration. You need to have access either to an academic partner or a medical librarian to access the Cochrane collaboration. But they are both, all of these are good sources of systematic review recommendations for evidence-based interventions. So I'm going to start with just a brief introduction to the community guide, which I know several of you are already using, but I'm going to just remind you of it again. So if you look at the topics that are covered in the community guide, over to the left, you'll see the third one is cancer. But if you look to the right, you'll see a number of other ones that are very related to cancer prevention and control. So nutrition, obesity, physical activity, tobacco, vaccination, worksite health, all of those can be important cancer prevention and control interventions. What works for health? Oh, so I should say that this is the Center for Disease Control and Prevention puts out the community guide. What works for health is Robert Wood Johnson Foundation. I love this website. We're not going to spend too much time on it today, but you can see the kinds of systematic review findings. And what this website does is it does systematic reviews of systematic reviews, and then reports on recommendations. So you can see health behaviors, diet and exercise again, tobacco use, clinical care. So this is a little different than the community guide with the access to care and quality of care. And then social and economic factors is another category. And then moving to the right, physical environment. So the strength of using a systematic review recommendation, and what you would do in your proposal is you would say, I'm doing a navigation intervention, and then you cite the systematic review. So you would cite the community guide, or you would cite citations from Using What Works for Health in support that this has been identified as evidence-based. Systematic reviews recommendations are the strongest source of evidence for effectiveness because they are findings from multiple research studies. A limitation is it's a broad recommendation. So it's not saying exactly how to do something. It doesn't give you many materials to do it. So it doesn't tell you how to do it, but it gives you really strong evidence that something is considered to be effective. The second kind of intervention we're going to talk about today is specific interventions, research-tested interventions that increasingly are being packaged with materials, protocols, and other resources to support implementation and delivery, and then the entire package is being disseminated on the internet. And so examples of research-tested interventions for colorectal cancer screening include smart options for screening, FluFit, and the FluFit and FluFOBT program. So you see there's specific named interventions. So we're going to just talk about one site, and I noted that a number of you are already accessing the Evidence-Based Cancer Control Program's website. This website is created by the National Cancer Institute and is a great source of research-tested interventions that have been packaged with the materials that you need to implement them in practice. So this is just to show you, this is the National Cancer Institute website. And they have a search engine with over 200 interventions. And to the left, you see you can select all different criteria to focus your search and then get the interventions that fit your need. These are the types of interventions that are posted on the EVCCP website. So you can see cervical cancer, colorectal cancer, diet and nutrition, HPV vaccination. Near the bottom, you see survivorship and supportive care is on here as well, and tobacco control. So it's a pretty comprehensive for cancer control programs. The strength of these is that they provide detailed guidance and materials to support implementation and delivery. Limitations are that only a subset of interventions have been packaged, and the guidance and materials may have been designed, for example, for a Korean population. And you want to use these materials in rural North Carolina. And so there might be questions about applicability to your population, and also a need to do some significant adaptation. Another challenge is some of these interventions are complex and resource intensive, which is a challenge. And if you use one of these, we will expect you to cite it, but we will also expect to see evidence that you plan to implement it as it was designed to be implemented. So not pick and choose which parts of it you want to do. So that can be a barrier to using these interventions, but you can go to them for ideas. So one thing you can do is look for a strategy from the community guide, cite the community guide strategy, but look for resources from an intervention that uses those strategies on this website, and look and see if there's materials and other ideas that can help you do the community guide. Broad recommendation. All right, so I'm actually have decided to change my activities a little bit for today. So I'm going to right now show you how to look at the community guide. Then I'm going to give you a few minutes to look at the community guide just to make sure everybody is comfortable with it. So I think I have to stop share. It's always scary when I do fancy things. Okay, I'm pulling up never a good idea to share your email, but okay. Community guide in my search. and I get the guide to community preventive services. So in a minute, I'm going to let you do this on your own. So I'm at the community guide and I go to topics and I'm going to look at cancer. Now, when I pick cancer, what I get is at the top, there's some general information. And then as I scroll down, it starts providing me all the recommendations. So all the systematic reviews that they've done. So the first one is their systematic review on patient navigation services to increase colorectal cancer screening. And then you go to patient navigation to increase cervical, and then you go, et cetera, et cetera. And you can see there's a whole lot of them. That's pretty time consuming. But if you go right here, there is a summary table that you can get to if you scroll down. And so these are all the interventions that they, reports that they have. So interventions engaging community health workers. And you can see that's recommended for breast cancer, cervical cancer, and colorectal cancer. And so to the left, you see all the different ones. You can see client incentives, so giving clients money or other incentives. So that gold, what do you call that? Diamond, it's a diamond. That gold diamond indicates, nope. It doesn't mean it's not effective, but it means we just don't have the evidence to say that that's effective. So you don't want to claim that as an evidence-based intervention. If we keep going down, and I'm probably making you all seasick, you'll see we get to preventing skin cancer. All right. So I am going to give you all like till 25 past to get on the community guide website and see if you can navigate and look at a few different intervention options in your area of interest. And then we'll come back together at 12:25.
The link's in the chat if you're having trouble finding.
Thank you. Mary has put the link to the community guide in the chat. All right. Was everyone able to find any questions, any concerns? All right. So there are a lot of evidence-based intervention possibilities. Oh, there's chat. Let me see what's in the chat. Oh. So you can minimize Zoom. I'm sorry, I didn't notice this till now. And then go to another website. You don't have to leave Zoom to go to another website. All right. There are a lot of evidence-based interventions to pick from. And so this is a quotation from a number of years ago from a practitioner working in obesity prevention. But the general idea is common across. And the quotation is, honestly, the frustration right now for me is you've got Robert Wood Johnson, Policy Link, CDC, Convergent Partnership, you name it, and every day somebody is coming out with something. And so how can we pick and select from among the options? And so we recommend these steps to finding an evidence-based intervention. We recommend that you start with systematic review recommendations and then see if there's a systematic review approach or recommendation that meets your need. And then you might look for a research tested intervention that uses that approach. And then you might look for peer reviewed literature. So that's going to PubMed and talking to a librarian to get additional information. So this is one approach to beginning with this question of how do you find an evidence-based intervention. And always start with your SMART objective. So last time we met, Mary talked about writing SMART objectives that really initially you're writing them to get a broad idea of what it is you hope to do. So this is a broad objective. By December 2025, Chatham County colorectal screening rates will increase by 10%. So we already know in this case that we are looking for interventions to improve colorectal cancer screening rates. And we also know from the data we collected, based on what we learned from Mary, that we know something about the population we want to do this with, who has the low screening rates. We may also know something about the factors that are contributing to low screening rates. All of that will help you to narrow down your evidence-based intervention. So as you find interventions, you're going to want to think about effectiveness, implementation. So what is the potential for this to be implemented in real world practice? And how well does the EBI fit your local context and population? So we're going to start with effectiveness. And so I'm going to focus on those first three. You want to think about whether the methods used to test the interventions or review the intervention studies were strong. I could teach an entire course on that. I think if you go to reputable websites, you can trust their methods. That would be my recommendation. So National Cancer Institute and the CDC created two of the ones we looked at. Robert Wood Johnson Foundation created the third. Within those websites, they often give ratings to interventions. So they'll tell you what the methods for the studies themselves were and whether or not, how confident they are in the effectiveness of the intervention based on those methods. And we'll talk a little bit about how they do that. The next bullet is, are the findings current? Was the systematic review done in 1999? That's a problem. The magnitude of the effects is the third one, and that is how much did it improve? So if it's colorectal cancer screening, one intervention may have improved screening rates by 5%. Another one may have improved them by 10%. So that's one of the things you want to be thinking about. So if we look at applying these criteria using the guide, the community guide. So if you go to the About section on, and many websites, this is true, they have an About section that will tell you about their methodology. So that is one option if you do want to dive in and see what methods they use to review the literature. You can also look and see here over on all of them, they tell you their opinion of the evidence in support of their intervention approach based on their review of the methods of the studies that they reviewed. So this case, which is interventions engaging community health workers, they consider this to have strong evidence. You can also see how current the review is. So this review was completed in April of 2019, which is pretty recent for the community guide. It's 4 years ago, but for the community guide, that's pretty good. The next thing you want to do is look at what they found. So you'll click on what they found, and what you'll see is you have a summary of results, and that tells you how many articles were reviewed. In this case, it's 66 studies overall, 17 of which were on colorectal cancer screening. And then you can see the magnitude of the effect. So what you see here is that first bullet in the orange box says up to date with any test. Overall, the 9 studies they reviewed that had this information, they saw a median increase of 12.5 percentage points. So that's pretty good to increase screening rates by 12.5%. The next thing you want to ask yourself about the interventions that you find is, can it be implemented in real world practice? So you can have the most effective intervention ever, and if you can't do it, it's not going to improve population health. If it's too complex, or if it requires too many resources, or you don't have the information you need to implement it. And so one way to think of this is called the RE-AIM framework, which really asks, will it reach, which is the R in RE-AIM, the intended patients and populations? The E in RE-AIM is effectiveness. Will it be adopted by providers in practice settings, which is the A in RE-AIM? Will it be implemented with fidelity or as it was designed, and will it be maintained over time? So that's RE-AIM. So some things to ask yourself as you consider whether this can be implemented. You could look and see if the prior studies of the intervention provide evidence that it can be implemented as intended. You also can look at whether there are intervention materials and implementation protocols available in formats that are ready for you to use. You also can talk to your partners and see what they think about whether this intervention is something that they could do. And also whether they think the population you want to reach will participate in the intervention. So we're going to look at the EBCCP website to look at both effectiveness and implementation criteria. And so we're going to look at the Flu Fit and Flu FOBT program. And this is a program as described in the program synopsis that provides colorectal cancer screening at the time that people come in for their flu vaccine. And you can see that the EBCCP gives scores. So they give you this information on their website. Research integrity, and unfortunately websites use different terms. Research integrity is essentially research methods, and they give this a pretty high score for research methods. Intervention impact is the magnitude of the intervention, which they give moderately good. Dissemination capability is everything there that someone would need to do this, and they give that a very high score. To the right, you see they also give this program a re-aim score. So they tell you what the research evidence shows about this intervention's ability to reach the intended population, its effectiveness, its adoption by providers and settings, and its implementation. Were real-world settings able to implement this in practice? And so you see scores there. Then the website provides links to program materials, and often the person who developed the program. So the second activity, I'm going to do this also slightly differently, and I'm going to walk you through the EBCCP website, and then I'm going to give you a chance to get on the website and see if you can get an answer to how current is the information, what rating do they give intervention effectiveness, what implementation materials and guidance are provided. So let me pull up EBC website, and here I can go EBCCP, and I will get to the website. And so if you go to search for programs, this website I think is incredibly intuitive, easy to use. You don't even, you just do it. Search for the programs, then you can filter what you're searching for by all of these. I'm going to suggest you focus on program area, and this time, so we'll do colorectal cancer screening again.
I think you're showing your slides, not the website.
Oh my goodness.
It's
I'm
okay.
so glad you said that, Mary. How
Yeah.
long have I been doing that? All right. So this is the website. If you click on, can everybody see the screen now? Okay. If you search for programs, all right, and there is a search engine on the left. This is a really simple site to search. And so if you go to colorectal cancer screening here, you get 22 programs that are all colorectal cancer screening. You can narrow your focus using these other filters, but I'm going to just look at colorectal cancer screening. I'm going to click on the first one. And here you have your intervention, program synopsis, program highlights, program materials, and the program developer. You see your scores, both for, to the left is research integrity or methods, magnitude of intervention or intervention impact, and to the right are your re-aim scores. And then here's more information about the program. So now I'm gonna, Mary's gonna put the link in for EBCCP, and I'm gonna give you about 3 minutes to go on and search for a program or an research tested intervention. So at 12:41, we'll resume. So were you able to access the website and look at some of the interventions? Any questions, concerns? All right.
Yes.
Good. And after this training, any of you who have any questions or want a little guidance on finding an intervention, please reach out to me. I would be happy to talk with you further. And I also want to note that Mary sent you a list of websites where you can look for evidence-based interventions with their links for the internet. So there's more than just the ones we're talking about today that you might go to look for.
That was the list I sent with the first training. If you still need it, if you didn't get it, let me know.
So the final question is, how well does the EBI fit the local context and population? And so here, starting with your health problem, in this case, colorectal cancer, objective is to improve screening, population. So do you want to do it in a rural African-American population setting? Are you going to do it in a church or a clinic? So often setting is who are the partners at your table who are willing to work with you. Other factors are those factors that are contributing to the problem, which are some of the things that Mary talked about last time. These are all things to think about as you select the intervention that fits best with your community. What resources do you have? So review data you collected on factors. So if you look here at the bottom, last time we met, Mary talked about, are folks telling you they're having difficulty tracking the FIT screening tests or the colorectal cancer screening tests? Are they telling you that there's a lack of transportation or insurance coverage to complete diagnostic screening? If those are the big problems, then look for an intervention that's targeting those problems as a way of improving screening. So your final decision will be a balance across these three criteria. You may not pick the most effective EBI. If it may be a combination of effectiveness, can we implement it, and does it fit our needs? And so you're really balancing all three of those questions when you pick the one or more evidence-based intervention that you're going to implement. And if you don't on any of the websites we've talked about, then you may need to look at the peer-reviewed literature and talk to a librarian. And if you are working with academics, they can help you access a librarian, or you can work with your local AHEC. And all the AHECs have librarians available to work with you. So the final thing we're going to talk about is, once you find an evidence-based intervention, you still may need to adapt it. And this is particularly if you're going to use a research-tested intervention, a specific intervention. The expectation is that you will implement it as it was designed. So you won't just take parts of it, you'll do the whole thing, but you may need to adapt it for your population. And Mary also provided you with a handout that provides guidance on what you can and cannot adapt. And the green are things that you can adapt, and they include things like you can put your logo on materials. Yellow you can make with caution, and red are things you should not change about an intervention. So Mary, was that sent out with the first time too? No, that was sent out today?
Yes.
Okay, that was sent out for you today. We also have training on adaptation. If you do want to learn more about adaptation, we have a training that you can access on our YouTube site, and the link to it is provided in the slides. So that is what we have for today. We've completed that, and now we've completed the evidence-based interventions. And next time we meet, we'll talk about writing a project plan and an evaluation plan. Are there any questions?
Yes, I have a question about, can you go back to your slide that showed the adaptations that had the stoplight on it?
Yes.
Okay, so now where would we see these that shows what we can, like the red, yellow, and the green? Where will we see these in our the program?
So the packaged interventions are not going to say you can adapt this and you can't adapt that. You won't see it in the intervention, but the handout that Mary gave provides general guidance on the kinds of things you can and cannot adapt.
Okay, got you. Now I understand.
Yeah.
Okay.
And if you want to talk further about that as well, please reach out as you're working on it.
Okay, thank you.
Yeah. Any other questions? All right, if you can, Mary, can you put the post evaluation in the chat? And if you'll, then we'll be, thank you all.
Yep, and the post eval will also be going into the, will be going out in an email at 1 o'clock.
Okay, yes, Paulette?
Yes, I did have another question. Just as you showed that just before the post evaluation, when you showed about the grant again, in the beginning, right here, in the beginning, you talked about, you said something, but it's two different ways you can apply for this.
Yes,
is that correct?
I can say that again.
Okay.
There are 2 levels of funding. So
Okay.
you can get $10,000 to engage your partners in planning. So if you at this point in time don't know for sure what evidence-based intervention you want to do, you probably want to go for the $10,000 grant. And that will provide funding that you can talk to your community, talk to your partners, collect some initial data, do some planning, and select an EBI. And then the next rounds, you can apply for the $20,000 to implement that EBI. If you already know what EBI you want to do, and you can provide us information on how you've engaged your partners in deciding that, and that they're ready to support you, then go for the $20,000 to implement the EBI.
Okay, gotcha. I understand now. Thank you so much for that.
Great. Any other questions? All right. Thank you all. Enjoy your weekends. It's beautiful out there.
It is. Thank you for your time and for all the information.
All right. Bye-bye.
Have a good weekend, everyone.
Bye-bye. You too. Thank you. Thank you, everybody.
Thank you.